Hello, my name is Elise Terza Ohene-Kyei. I'm an adolescent medicine fellow and pediatrics infectious disease postdoc at the Johns Hopkins University School of Medicine. I'm excited to share on behalf of an incredible team findings from our recent study presented at the Society of Adolescent Health and Medicine conference titled, "Where Did Everyone Go? Unpacking Clinic Missed Medical Appointment Rates Among Youth Living with HIV." This analysis comes from the SAVI study, which is the strategies to achieve viral suppression for youth living with HIV. The central idea behind SAVI is that if we provide informed antiretroviral therapy counseling and improve access to long-acting injectable therapy, we can increase and sustain viral suppression among adolescents and young adults living with HIV. This age group has the lowest viral suppression rates compared to all other age groups, and this disparity is often linked with challenges with adherence to antiretroviral therapy and retention in care. While implementing the SAVI study as a way to potentially improve adherence and engagement in care, we run into a fundamental barrier. We had 208 eligible participants, but 93 of them, nearly half, missed at least one clinic appointment. That's a 45% missed medical appointments rate. And because enrollment required patients to be present in clinic, we were only able to enroll about a quarter of those eligible. That led us to ask a critical question. If patients are not coming to their appointments, how do we deliver scientific advances, evidence-based interventions, and promising research to them? So we examined the relationship between missed medical appointments and viral load, along with structural factors such as appointment time, clinic site, using Poisson regression, and we reported incident rate ratios with 95% confidence intervals. Our overall model was statistically significant. We found that first, morning appointments were associated with 40% fewer missed visits compared to afternoon appointments, which is quite counterintuitive to what we expected. Second, the pediatric and adolescent clinic had 51% fewer missed visits compared to adult clinic. Also, older adolescents and young adults were more likely to miss appointments than younger adolescents. And while we have not yet measured this, that may reflect some psychosocial factors such as competing work and family responsibilities, increased independence in managing their own care, and the challenges associated with transitioning to the adult clinic setting. We also noticed that across all age groups, participants with undetectable viral load were more likely to miss medical appointments. And this was surprising because patients with undetectable viral load typically have much fewer visits in a year. So what does this mean and where do we go from here? Our next steps include qualitative work, listening to youth to better understand their perspectives, practical trials to test youth-centered scheduling and transition strategies from the pediatric and adolescent clinic to the adult clinics, and more studies evaluating whether long-acting injectable ART can reduce missed visits and improve long-term viral suppression. The bigger picture is that missed medical appointments in youth living with HIV may reflect some system-level issues, and the high rates that we observed in this study point to some practical clinic-level opportunities to improve. At the end of the day, improving adherence to antiretrovirals and engagement in care for young people with HIV is not just about reducing missed visits. It's about protecting their long-term health and their futures, and it's up to us to redesign systems to truly work for them. I'm deeply grateful to the SAVI team for their continued dedication to this work. Thank you.